because my son, as I said, he was only able to eat a little bit at a time, just a tiny bit, and then he was pulling his head back and crying and in pain. He was clearly in pain. So I went to see these women at the hospital who specialized in that, and they said, well, he knows what to do, and there's nothing wrong with what you're doing and with what he's doing. She said, I think it's because of his head injury. He's acting like he's in pain. And then also I went to them because I got thrush, which is common in breastfeeding. And it shows up as a rash around your breasts and is very painful. It can also affect the baby. Usually the mother and the baby get it at the same time. It can make their mouth sore. And sometimes you have a little bit of a rash in the baby does in the genital area. And they can get like on the tongue too. It's just like an overdevelopment of yeast from breastfeeding. It's very common. A lot of women get it, and it's one of the most common things that can happen after you have your baby. So when I when this was going on, I talked to several people about it, and I was given some topical things from Dr. Butler, like a couple of gentian violet or something, things to put on top on the surface. But when I saw the breastfeeding women after 3 months of this, they said, this is systemic. It's systemic for you, and it's gone systemic for your child. You need to ask Dr. Butler for a treatment for systemic yeast for thrush. And when I went to Dr. Butler, he refused. And I thought, that is really weird. And he not only refused to treat our thrush, this is when I knew that he was trying to set me up to have my son taken away from me. He told me to go. He said, well, basically all of the breastfeeding specialists and doctors know that if you put a breastfed child onto baby formula, sometimes often, if it's over 2 weeks, they won't go back to breastfeeding because they prefer the formula to breast milk because it's so much more sugary. And who knows what else gets put into some of these formulas that, formula makers want babies to prefer their product. And so Dr. Butler said, well, just quit breastfeeding for a little while, and here is, pick up some formula from the WIC Center, and give it a rest for just a little bit, and then see how it goes. And when I showed up at the WIC Center, they said, why is Dr. Butler trying to put you and your child on formula? They said, maybe for a few days, but if you do it any longer than that, your child will not go back to breastfeeding. And the child will basically be weaned onto a formula bottle. And I don't know how to describe how I knew intuitively. Dr. Butler and Stacy Stubblefield were trying to have my son taken from me in the hospital. And I had people trying to take my son from me before he was even born. And then when Dr. Butler refused to treat us for thrush, which he could have done, which would have allowed us to keep breastfeeding and keep that bond together, he was wanting to wean my child from me. So he knew that he knows as a doctor that breastfeeding is the best thing for an infant. And yet he was trying to have my son on a bottle and not breastfeeding with me. And I had a very strong feeling that the reason he was doing that, and the reason why he didn't want to treat us for thrush and didn't want us to continue breastfeeding, is because he and the other federal workers already had intentions and designs on taking my son away from me. And they first wanted to wean him from the breastfeeding so that someone else could give him a bottle. And so I basically let him take the formula for just a really short time, and then I refused, and then I went back to him and said, I need to be treated. I'm going to continue. They said that my son will quit breastfeeding if I do this, and we need to be treated. And he still refused. So I thought that's really strange for a doctor just to refuse treatment on something like that when it's covered by insurance, fully within their power, and it's really clear by a lot of people that that's what the problem was, why would he refuse to treat us? And at the same time, I found out, I asked, because he was still in a lot of pain and everything, I asked for his bilirubin levels to be checked again, and they were at 3 months of age, 3 months after he was born. He had excessively high bilirubin levels still, according to the labs. So that's not common. 3 months later, he has abnormally toxic levels of bilirubin. I mean, his head injury was much, much worse than it appeared to be. And he still had a scab. His scab was falling off and then reforming on his head. And he, at 3 months, still had a scab on his head from that. So his internal bleeding was still occurring, and I think that that what was done to his head, it was much worse than they wanted to admit. And so then they started trying to portray me as a hypochondriac. I wanted my son to be treated for thrush, and his bilirubin levels were really high, and all of a sudden he also was being vaccinated. So at 2 months or something, he had his first little shot, and then the next time that he went in for vaccination, he was given a double dose of something, or something that they were experimenting with, because they wouldn't give me the batch number and they wouldn't release the information to me when I asked for it, because I was going to report his reaction to the vaccination people, adverse reaction people. And these doctors and that entire community and the health center refused to give me this information for a year. My son was he had gone from normal health to being extremely sick after this one vaccination. And the other thing about Dr. Butler is, I remember that my son didn't like him. He was just a baby. He was an infant, and Dr. Butler made this mean face to him, and why Dr. Butler did that, I don't know. But my son started to cry and reached for me. He did not like Dr. Butler at all, and I looked at Dr. Butler, and he was looking at my son with hate. I don't know what his personal problem is, but I don't think Dr. Butler's a good person. When you have an infant that is intuitively rejecting a doctor and afraid of a doctor, I think that's a bad sign. And not only that, I knew what some of the things Dr. Butler was doing. So, in addition to the things that were happening with my son and the refusal, here Dr. Butler is treating my migraines with narcotics, but he's not going to treat our thrush so we can continue our breastfeeding. And then at one point he also said, "You're not going to be one of those mothers that breastfeeds your kid until he's 5 years old, are you?" And I said, "No." I said, "Maybe for 2 years or so, until he's about 2, or whenever he decides that he wants to quit." And he didn't like that response. I mean, Dr. Butler wanted to have my son on a bottle and taken away from me. He is a federal government employee. He works in experimentation, and I don't trust him as far as I could throw him. And so the other thing that occurred is I was still having a lot of problems with after the childbirth. And finally, after about a month, or maybe 2 weeks to a month after I was out of the hospital, I was able to urinate on my own again. And I had to see a urologist for that. And then I was told that there was nothing wrong with me, but I asked him for a CT. I said, there is something wrong, and I really need a CT. So Dr. Butler did order the CT when it was about 3 months after the childbirth. But then he said, everything's fine, everything's normal, there's nothing wrong. Well, I got the lab report, and I got the radiology report for the CT. And it said right there on the CT, it said abnormal fluid needs follow-up. So there was some kind of abnormal fluid in my pelvic area that wasn't where normally you would have fluid of any kind, whether it was blood, whether it was water, some other kind of, something else, I don't know, and obviously the radiologist didn't know. But it said right there on the report, abnormal fluid, needs follow-up and do another diagnostic. And because it said origin or etiology or whatever is unknown. So later, and it wasn't near my tailbone, it was in my pelvis. Much later, when I later went to, which I'll talk about again, but when I later went to the emergency room at University of Washington and they did an x-ray, they showed a broken pelvis. And it's very possible that because my pelvis was broken, I had abnormal fluid there for some reason because of that. And first they had it written down that it was because of the traumatic childbirth, and then later somebody edited the medical record. Because when I got another copy, when I went back a couple years later, somebody had deleted that entire section about possibly due to, indication is that it's from traumatic childbirth. Somebody had deleted that from my whole record. So anyway, the so I pointed that out to Dr. Butler, the part about the abnormal fluid, and then right about that time that I was pointing that out and I was trying to get my son's vaccination records, he was becoming hostile. And the nurse who gave my son these vaccinations and picked up the documentation that showed what vaccinations he'd received, she was very hostile towards me too. I could tell that she didn't like us and there was something wrong. And then sure enough, later my son was extremely ill for a long time. And the other thing that happened is after I had my son, I went to the dental clinic and for a filling. I had a couple of cavities. And they basically, I had my son with me and he was sitting in the carrier. He was there, he was asleep, taking a nap while they did the work. But it was a Mexican, and by that time it was 2006 because I had my son May of 2006. By that time, it was a Mexican dentist first, or some sort of Hispanic dentist, he was Mexican, was working on my tooth. And then he was saying he couldn't do something right, or he was looking, and I don't know, it was kind of a weird situation. And then I remember there was a white tech, like a nurse tech for the dental people, and I never even saw her face. She kept this mask over her entire lower face the entire time, like a white surgical mask thing. And I had a really bad feeling from her. I could tell that she didn't like me. She was hostile towards me, and I had a bad feeling. And then the next thing that he said is, well, I need to have you have the other dentist look at this. The military guy. So then I was told to go into this different other room. And this military, he was a U.S. military employee. I can't remember which branch of the military. But then he worked on the filling. So I think that first the Hispanic guy was working on my filling. And then he referred me over to the U.S. military guy, who was very methodical and pretty detached, just did this work. And then right after that, it was like all these people were smirking when I was leaving their offices, and had a really weird feeling about what had maybe just happened. And then they told me to not come back. They said that, well, we've done all the work that we can do on you now, and you're not eligible for any more fillings. And I was. According to my insurance, I was eligible to continue having work done on my teeth. But after they did this one filling, they basically didn't want me back. And they said, we don't want you back. And when I found out, or when that clinic was connected to the clinic that Dr. Butler ran, because he was the director of the whole clinic. And he was also trying to have me kicked out of WIC, which is a federally run program. And that's where it's separate from this other clinic. like the Columbia Valley Community Health.